Hi, this is Mitch Mitchell of TT Mitchell Consulting. I'm going to talk about the relationship between charge capture, charge master, and medical billing. Hopefully, I can get enough through and still keep this video kind of short. So, what is the relationship? Well, the relationship is that you have charges on the charge master that have been pre-priced and pre-coded. You then have services done in a different department or a bunch of different departments, and the people there pick the services that they do. Then those services go into the system, and then they come out on a medical bill, and the bill gets sent out. That is how the process is supposed to work, and for the most part, that is exactly how it works. Now, the thing is that a lot of people blame billing for the charges that come out, whatever. And let me tell you the truth: it has nothing to do with billing. Billing does not put a single charge on a single bill. It doesn't happen. As a matter of fact, probably about 90% of the bills that go out from the hospital are never seen by a person in medical billing. If, for instance, most medical bills these days go out electronically. So if all the information is correct up front, taken when you come in to register, and if all the charges are selected and come across on the computer system, and if medical records does its thing and it codes the bills in time, then these bills go out automatically. So most of the time, no one sees anything. They will see the bills if it's a no fault, which basically means if you were injured in a car in some way, or compensation. Those states that don't have compensation, or those states that do, those bills are usually sent out on paper instead of through electronic means. And if you have an out of area insurance or a small insurance company that doesn't handle electronic billing, then those bills will go out that way. And self-pay bills obviously have to go out on paper. But everything else goes out electronically. So the billing department never sees charges. They just don't. And if you call up to complain about charges and you call in the billing department, you're calling the wrong people. They don't know. They just don't know. You might get lucky if you ask for a director, and maybe you'll get lucky and have a director who knows a little bit about it, or you might get lucky and have a hospital that has a charge master coordinator. But truthfully, just to get this out of the way, if you're worried about charges, pricing, and whatever, you either need to ask for a charge master person, or you need to call the department that did your services. And that just gets that out of the way. So the reason that, like I said, you have your charges up front and your charge master to make charge capture easy. Most departments will capture charges one of two ways. Either they will capture it on some kind of charge sheet that lists all the charges for a certain department, or they will mark things down based off of the record that you've taken to the hospital, the script, if you will, and they will go over to the computer and they will pick the charge then and there. The only difference sometimes is that if they pick it then and there, then it's that person directly who's doing it. Whereas if you put it on a charge sheet, quite often they're batched to someone else who then enters all the charges for all the patients they saw that day. So, there's this thing where it really is a symbiotic process between all three departments. Now, the people in the departments, they also don't price anything that they do. They don't know the prices. So if you're calling them up and you're going to yell at them because of the prices of some of the things you did, they're the wrong people also, because they didn't create any prices. Prices are created elsewhere. Like I said, if a hospital has a charge master person, that person probably had a hand in it. Most probably you're going to want to talk to a chief financial officer. Don't call the CEO, because CEO isn't going to know. Matter of fact, the chief financial officer probably won't know either, but they will have a better idea of how to find out what the pricing is if they don't have a charge master person. It really ultimately comes down to the chief financial officer to know who is responsible for pricing all the items in the hospital. They may not, and that happens because you don't have CFOs that really stay forever anymore. The average per Modern Healthcare magazine is about 2 years and 6 to 7 months. So, it's not the most secure job sometimes, but that's just, national averages. That's just how things go. So, and you're probably wondering about, how departments know how to capture certain charges. Well, one, they know how to do it because they see the script that comes in. So say you're at your doctor's office, the doctor says, I want you to go and get these labs. The doctor ticks off certain things, or they'll write these codes on there. Then you go to the hospital sees what these codes are, and they, know those codes relate to this or that or whatever, and that's how they decide. Some of the things that a physician may send you for may include multiple lab services at once. They have these panels that will do a bunch of services, and every once in a while, some hospitals work with certain physicians and create physicians panels, which basically says every time Dr. Jones sends a patient here and he writes this number down, he wants these specific services. And the services might be included into a certain panel number, which is actually its own procedure code, in which case you'll only get billed for the one thing. But if it's not, if it includes things that are beyond the scope of that particular code, then you're going to get charged for those things individually. That's just how it works. Every once in a while, doctors will send codes that don't match up with the diagnosis that they're supposed to send along. And at that time, a hospital is supposed to tell you, hey, this doesn't match up. Now, some hospitals will call the doctor's office and say, these didn't match up. Do you want to add a different diagnosis code? Do you want to remove something? In which case, everything goes smoothly. You don't really know anything about it, and life goes good. If that doesn't happen, because hospitals are really under no obligation, but a lot of them will try to do that, or if they can't reach the physician, then they're supposed to tell you. They're supposed to have you sign off on a form called an advanced beneficiary notice and, basically tell you your insurance company will not cover this. So at least you're supposed to know that, or at least they're supposed to do that for you. And do they all do it? They're all supposed to. So yes, if they're not doing it, and you find out about it, you can always file something, and then basically you're not responsible because they didn't tell you. So that's pretty much how that is. And the reason I decided to talk about this is because there are a lot of people who complain about the price of their hospital bill. And yeah, do you have a right to complain about certain things? Yes. Should you know certain things? Yes. Is it your responsibility as a patient to call and find out, hey, is this covered? Yes, because that's the only way you're going to know. So you should call your insurance company, call the hospital, find out what the prices is. Ask your doctor, what's the diagnosis code and what are the procedure codes that are going to be on here so that I can find out if this is everything I can pay for. What kind of medication are you sending me for so I can find out how much that is and if my insurance company is going to pay for it or how much they're going to pay. Don't blame the billing department because all they do is just send out the bill and try to get everything paid. Don't blame the people who pick the charges because all they're doing is picking the charges that go, on the bill that say what services that they did. Yes, you can complain about price and you can always shop around for price, but every once in a while, everything is just exactly how it's supposed to be. But at least if you're informed, you'll know ahead of time. And by the way, every hospital will work with you and try to help you get your bills paid. So there you go. Anyway, if you have any further questions, please leave a note. And I hope this covers some of that. If there's anything you're wondering about, leave me a note on that, and I'll try to answer it. Take care. Have a great day.